advancement in technology and economic growth has led to the improvement in overall healthcare status worldwide. However, there are certain parts of countries and there are many countries with internal as well as the external healthcare inequity still do exist. Uh, and there are various factors such as inefficient number of competent staff, limited resources, increasing aging population, as well as lifestyle related diseases all has come together and led to inequity in healthcare. But the inequity, as mentioned earlier, it is preventable and avoidable. It is mainly affected by socioeconomic as well as environmental factors as discussed earlier, and therefore we need collaborative approach so that though the Ministry of Health in Malaysia has put in place many projects like mobile clinics, flying doctor services, as well as telemedicines, and they have opened hundreds of new clinics and hospitals around the country. But the government also need to emphasize on the peripheral areas, such as, for instance, building a world-class hospital or a tertiary hospital does not mean that every individual will get easy access and affordability to that hospital. Therefore, government also must look into the affordability as well as accessibility criteria. Say, for example, if patients earning weekly earning is just around 70 to 100 ringgit, and how can he or she can afford for the follow-up visits, which for the traveling it takes nearly 40 to 50 ringgits per visit. So these all factors, the small peripheral factors also need to be considered. Issues such as inadequate integrations between public and private sectors, then poor quality healthcare in public hospitals, as well as marginalized populations and more private clinics in urban settings, and poor accessibility of public health delivery system. On top of that, out-of-pocket payment, all these issues lead to issues need to be tackled carefully in order to optimize the healthcare delivery system in Malaysia. So there are few ways where the optimum healthcare can be achievable and delivered to Malaysia, like such as health education, school health programs, and sanitation programs must be mandated for all schools, including the private schools. Medical personnel must be encouraged to join government hospitals and clinics by providing incentives or bonus or some kind of reward so that they are happy or they are willing to join the government hospitals or clinics that are in remote areas or in rural areas. As well as the IT facilities, the technologies must be provided to them so that they can, even the people can get easy access to the specialists. Thus, I would like to conclude that the Malaysian healthcare system has functioned well over the years compared to the countries of similar economic status. However, the public system has not kept in pace with the population growth, and the expansion of the private health sector means that the people in upper income class groups, they can possess quicker as well as easy access to the private healthcare, whereas those people who are in the lower income group, lower middle class group, or the poor people, they have no choice but they have to depend on the government services. And thus, on top of that, the expenditure is required to cover needy population groups, particularly in the remote areas of the states like Sabah and Sarawak, where the services are hardest and most expensive per capita to provide. So the healthcare therefore should be concern of policy makers in every sector, not just the health sector, but the other sectors such as education department, the finance department, all sector must combine together and give a comprehensive healthcare delivery. So thus it is concluded that the good health just not depend on, it depends more than just an access to medical facilities. That's all from my part. Thank you. These are
Okay,
the references. Thank
good
you.
presentation. Any questions? Okay, we move to the next presentation. You have one more presentation, right?
Yes.
Yes,
Okay.
move to the
I
next one then. Yeah.
Yes.
Can I just close this one now?
Yes, yes, yes.
Just a minute.
You minimize this Google Hangout and then,
Yes.
yes.
Okay.
Hi, Uncle.
Hello, sir. Yes.
Hello, sir.
We can see you.
Uh,
Amanda?
There was some problem there from the group invitation when I'm sending, it was actually not going to you. That's the problem.
uh, yeah, okay.
Finally, individual invitation I sent, then that one went.
Yeah. Anyway, I'm in now.
Mm.
Okay.
Sir, can you see this
Yes,
migrants in?
yes, yes,
Okay.
yes, we
So
can
I
see.
just straight away
We
go
can
to
see.
my part now.
Yes.
Migrants and threat to healthcare in Malaysia. The reflection of the seminar is while most Asian member countries have signed they have signed declaration on the protection and promotion of the rights of the migrant workers, the health right of the migrants is still need to be addressed, especially with the ongoing universal health coverage, which reforms most Asian countries. Malaysia is not party to 1951 conventions relating to the status of refugees or the 1967 protocols which indicates the status of refugee. Thus, the refugee status in Malaysia does not in Malaysian law it does not exist. Therefore, they have been considered as irregular migrants. Say for instance, countries like Thailand it does allow undocumented migrants to go for the compulsory migrant health insurance scheme, whereas Malaysia and countries like Malaysia as well as Singapore are still yet to consider including migrants in their government-run um, universal health coverage system. Therefore, I would like to conclude that thus, by improving migrant health coverage, Malaysia can make universal health coverage system truly universal and can make it truly accessible to all the peoples including the migrants. So migrant inclusion in the universal health coverage system is a human rights imperative, and it's in Asian best interest to protect the health of migrant as it pursues towards a collective social progress as well as the regional economic prosperity can enhance. And it also needs to be emphasized that local as well as the migrant workers both need to be treated equally because it is a part of Asian countries' agreement with protection for the migrant workers, especially for the domestic workers, in terms of labor and health rights. And that's all from my end for this seminar. And these are some references. Thank you.
Okay, any questions to Purvi? If you want to ask any questions, to unmute yourself. Yes.
There is no question, Dr. Ankur.
Okay. Thank you.
Okay.
So I just close this one, yeah?
Okay, then. Shall we move to the main presentation of today?
Yes, yes, sir.
Okay, cool. That one you delete, yes. Close.
Okay. Then I supposed to go for my video cam. I need to put it on, right? Camera.
Yes, now actually who is presenting? One of you have to put up the, share the slide with all of us.
Yes.
So for both these presentation, Purvi's presentation was the last part of it, right?
Yes, sir.
Okay, okay. Yes.
And three is
If
preventive.
correct, I'm sharing now. Is it full screen?
It's not full screen yet, but we can see the slides.
Ah, it's 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 not full.
It's not in full screen, Antri.
Oh, then
Excuse me, sir. Dr.
Yeah,
Ankur.
yes, tell me.
Sir, here I'm on the top. I'm getting the green, like you are screen sharing, and the stop button. So shall I stop now? Because this
Yes,
is
yes.
for my previous.
Oh, your thing is over, right? Yes.
So I
Then
can
it
see.
will work, I think. Yes.
Yes.
Now,
Now my camera.
now tell her. Now the camera one, what you do is you just click on top. There will be an option, video camera. That option is there, right? Just
Yes.
switch it off. So your video streaming won't be here.
Okay. So I put off my camera.
Yes, that's it. Yes, done. Now on three, you can share your screen now. I think it was a
is
double
it full
sharing.
screen now?
Uh, Not yet, I think.
I already put a slideshow here.
Might be taking a little time for broadcast. Yes, we can see your thing. Now make it full screen. It is in the document view, I think.
It's already full screen, Dr. Shankar. I'm doing slideshow
Your
now.
side. Okay.
Yes.
It-
Antri, do you want me to share it?
Yeah, you share it then.
Okay, wait. Hold on.
This problem actually could not sort it out because sometimes we are sharing the full screen, but it is coming as a document view, right? This problem I'm not getting it, like how to resolve this.
Don't know.
Can you see it?
Yes, Meenakshi.
In full screen
Yes.
or in slide view?
No, now it is full screen.
Full
Yes,
screen.
coming.
Okay.
I'm not
Yes.
seeing anything.
Alright.
Okay.
Can you see?
Yes.
Yes, I can see it.
Okay, Antri?
Yeah, I also can see it.
Okay.
Okay. Shall we begin?
Yeah.
Yes, you start. Yeah.
Okay, good evening to everyone here. So this evening we will be presenting on social stigma and illness behavior across cultures. So I'll start off the presentation with the introduction. Next. Okay. Stigma is defined as a cluster of negative attitudes and beliefs which usually motivate the public to fear, reject, avoid, or discriminate people. And stigma could also arise due to some negative circumstances such as unemployed or living below the poverty line or many other social disadvantages. And one of the consequences of stigma is it causes unequal access to resources, for example, like educational opportunities or employment or supportive community. For example, those individuals who are having HIV, usually they will be very difficult to find any job opportunity or employment due to this stigma that exists in the society. Stigma conceptualization was made by Goffman in 1963, where he defined it as three important aspects. First is the abominations of the body, like physical deformities, like disable, for example. Secondly is the blemishes of individual character, like a weak will, passions, or rigid beliefs. And thirdly is due to tribal identities, like stigmatized conditions of race, sex, religion, or national origin. So social stigma is recognized as a component of social impact of illness. Why is it so? Because it eventually leads to an increase to the burden of the illness, and also it influences the effectiveness of case finding and treatment. Cultural contexts influence both the selections of conditions that are stigmatized and local manifestation of stigma. For example, mental illness is considered to be one of the social stigma. So those who are having a mild stage of a mental illness, usually they do not seek the medical assistance because of the fear of this stigmatization by the society. Therefore, this increase the burden of the illness as well as the treatment. Illness behavior, on the other hand, is defined as the psychosocial processes that are consequence of social cultural habituation, such as values, worldwide, and the like. Illness is not a disease. Why? Because those who have the disease may not feel it, or they can believe that they are ill. As such, illness behavior determines who is vulnerable to illnesses, and culture values highly will determine this illness behavior and what it means to be ill. The culture differences create various problems such as communication, rapport, physical examination, treatment compliance, follow-through. So what are the issues of social stigma and illness behavior across the culture? And what are the solutions to this problem will be further discussed in the presentation. Well, now my colleague will explain some of the terms and conditions that will be definitions that will be used throughout this presentation. Thank you.
Good evening. I'll go on with the terms and definitions that we have to know before we actually go into the main issues on the social stigma. So first thing is that the social stigma actually is a discrimination by a person discrimination of a person by the socials that they think that the particular persons are deviates from the social norms. So deviance is the behavior that against the cultural norms. And illness behavior is the manner that individuals actually think that they are ill, but the symptom is not enough for them to look for the doctor. So instead of visit to a doctor, they actually look for internet resources, any source of help to actually help them in terms of the to cure from the illness. So sick row is actually somebody that has been diagnosed with has been diagnosed to be sick. So they actually have the role characteristics that they want to the characteristics such as they excuse from the normal social roles. They are not held responsible for the illness. Like for example, for the sick person, they are actually need to seek for the healthcare professionals to cure from sick, and they must want to get well as well as they are expected to seek medical advice from the professional. Medicalization is a process by which the normal human conditions has been medicalized. Means that, for example, it's like the psychological disorder or the emotional issues such as stress or depression. It might due to the environment factors or social factors that cause the stress or depressions, but the medical professional has actually medicalized it as a medical problem, and they need the treatment under the medical professionals to be cured. And self-care is actually the behavior of the individual who actually taken care of themselves in terms of their own health and well-being. One of the example is like the self-screening exam or self-medications. And the cultures is actually the cumulative deposit of knowledge, experience, belief, values, norms from a group of people. And that's it for my presentation.
Good evening, everyone. I'm going to continue with the issues related to the social stigma and illness. First of all, let's talk about the circles, the vicious circles around stigmatization and social activities. If you have impairment and disability, this will lead to restriction of activities and social rules. This will also lead to negative labeling, which will lead to diminished self-esteem and stigma. This continuously will go on to isolation and withdrawal from social life, This will lead to lack of confidence and skills. This is a vicious circle that actually contribute to negative social views and stereotypes transmitted in mass media and everyday life. These are some of the stigmatized medical conditions. We have the mental illness, HIV, leprosy, epilepsy, tuberculosis, and obesity. Mental illness. Stigmatization of mental illness is one of the most important issues facing the mental ill patients. Individuals with mental illness, they suffer from a wide range of negative effects and impairments related to the disorder itself. These outcomes are actually exaggerated by societal stigmatization of their illness. This will create significant barriers to personal development and receipt of treatment. These significant barriers to positive outcome across cultures and nations threat value of mental symptoms, intolerance for diversity, and inaccurate conceptions of mental disorders. Individuals with mental illness are actually members of one of the few groups whose castigation remains socially acceptable. Words like retard, psycho, and crazy are the common names across cultures that both children and adults often use for mental illness people. So people usually perceive them to be dangerous, violent, incompetent, and a drain on societal resources. Also, mental illness patients, they are robbed of the opportunities that define a quality of life. Example, good jobs, safe housing, satisfactory health care will be very, very hard for people that have mental illness. And they also have restriction on fundamental social rights, and they have lack of access to continuing treatment because of the current lack of parity in health. HIV. HIV-related stigma refers to prejudice, negative attitudes, and abuse. They're usually shunned by family, peers, and the community as a whole. They usually get a poor treatment in healthcare and education settings, erosion of their human rights, and psychological damage. They also have limited access to HIV testing and treatment. Many countries now, they have laws that restrict the entry and stay and residence of people living with HIV. These restrictions include the need to disclose HIV status to they need to do like a mandatory HIV testing, and they need like an approval to stay, and the deportation of individual once their HIV positive status is discovered. As of October 2013, people living with HIV were subject to some sort of restriction on their travel or stay in 41 countries. HIV in healthcare setting. This, usually when HIV patients go to hospital, all their things are not confidential. They contain judgment about a person's HIV status, and also their sexual orientation or gender identity is not respectful. This prevents people from being honest to healthcare workers when they seek medical help, and it prevents people from receiving the help they need. HIV in the workplace. Social isolation and experience discriminatory practices such as termination or refusal of employment. Next one is TB. Patients with TB often experience rejection and social isolations. Patients with TB, they often hide their symptoms and fail to receive appropriate treatments. There are often economic and social outcomes with poor emotional quality of life, low self-esteem, and clinical depression, which may even lead to suicide. Single women who have TB often find it difficult to find life partners and are rejected. And also married women who have TB are abused by their in-laws and deserted by their husbands. Leprosy. Leprosy stigma, it's a social stigma that has a strong feeling that leprosy patient is shameful and is not accepted normally in society. The stigma of leprosy is a real phenomenon in many people's life that affect their mobility, interpersonal relationships, marriage, employment, leisure activities, and attendance at social and religious functions. And culture brief on causes of leprosy includes punishment for sin. So people perception on leprosy, they believe they are actually punished for their sins, or they have immoral conduct, example, sex with prostitutes, or they're bad blood, unclean blood, or they are cursed, or by a witchcraft, or it's just God's will. Leprosy can be hereditary. It can be a natural forces like body humors, hot air, and it can be undernourishment or or it can be a spontaneous appearance. Thoughts of leprosy patients. Leprosy patients, they're always shameful of this disease. They usually isolate themselves from society. It's very hard to accept that they have leprosy, and they never believe that leprosy can be cured. Epilepsy. Epilepsy is a disorder of the brain that causes a person to have recurring seizures and is associated with various social stigma. It has been given many names, such as burning disease, drowning disease, shameful disease, or simply it. But everywhere in the world, it is a hidden disease. Some of the social issues in epilepsy includes fear and other emotions, relationships, financial cost, school, employment, and driving. Thank you very much.
Good evening, everyone. Solutions to resolve social stigma and illness behavior across cultures. People with mental illness are labeled, as previously mentioned, as crazy or retards. This should be protested against. The aim of protest is to suppress stigmatizing attitudes towards mental illness. For example, interventions with this strategy are advocacy activities, educational support groups, and patient empowerment groups. Education. The aim of this is to increase knowledge about mental illness and provide facts that clarify false assumptions on which stigma is based. Contact. The aim of contact is to challenge public attitudes about mental illness through direct interactions with persons affected. Medicalization of mental illness to create acceptance by making it like any other medical condition should be reduced. Enforcing equal access to healthcare, housing, employment, and justice to mentally ill patients must be done. What is the importance of HIV/AIDS education for young people? It's always important to start young. When you mean education, it should always start in schools. This should be done to end the AIDS pandemic, AIDS epidemic. Young people remain at the center of the epidemic, and they have the power through their leadership to definitively change the course of the AIDS epidemic. It also helps to reduce the stigma and discrimination and to protect themselves from becoming infected. Education is an effective social vaccine against HIV/AIDS. The Global Campaign for Education has estimated that some 7 million cases of HIV or AIDS could be avoided by the achievement of education for all. For epilepsy, encouraging self-reporting and early treatment by promoting community awareness and changing the image of leprosy. Monitoring the performance of MDT services, the quality of patient care, and progress being made towards elimination through national disease surveillance systems. First, we need to recognize and act upon the complexity and variability of the social meaning of epilepsy, both across and within cultures. Second, we need to understand that while not all people with epilepsy embrace the notion of stigma, those affected by stigma need to be helped by developing resilience by providing guidance. Fourth, we need to address negative coping strategies and challenge negative assumptions in people with epilepsy themselves, both adults and children, their families, and their social networks. Leprosy. The WHO strategy for elimination of leprosy contains the following points: ensuring accessible and uninterrupted multi-drug therapy available to all patients through flexible and patient-friendly drug delivery systems, ensuring the sustainability of multi-drug therapy services by integrating leprosy services into general health services.
Meenakshi, your voice is snapping a bit. Can you talk a little slow?
Oh,
And
okay.
hold the, yes, yes. Now it
From
is
the
clear.
beginning,
Now
huh?
it's clear. Now it is clear. Yes.
From where, sir?
And talk a little slow. Then I think it can catch it. Yeah.
Shall I start, sir, from the beginning?
No, no. From this thing, just one slide back, you can again do it. That's it.
Leprosy
Yes.
strategy.
Yes.
Okay. The WHO strategy for leprosy elimination contains the following points: ensuring accessible and uninterrupted multi-drug therapy services available to all patients through flexible and patient-friendly drug delivery systems, and ensuring the sustainability of multi-drug therapy services by integrating leprosy services into general health services and building the ability of general health workers to treat leprosy. I'll now pass it on to Purvi.
Okay, good evening everyone. First of all, the reflection would be that although initially it was expressed as an area for the social research, but the stigma has now become significant issue for public health. It contributes to suffering, which may further harm health, and it interrupts with appropriate use of health services, even though it is obtainable, accessible, as well as affordable. So, as discussed earlier, the government's conceptualization of stigma has directed a wide range of social research studies. Hence, in this seminar, we have suggested some ways of reconsidering the concept so that it may be better guide for the public health research as well as for the policymakers, and the better action can be taken. Education is one of the important tool for any sort of change or intervention. Thus, with that, I would like to conclude that the social stigma, it is an important it is important of accounting for the particular features of stigmatized health problems and their socio-cultural context, and the value of identifying contributing factors, the factors which are responsible for these kind of social stigmas, and the effects of practical significance for health policies. So some of the effort for change, like though some people maintain negative image on cultural level, there should be more number of people should come out that that can fight for the rights of the people who are suffering from these kind of illness or diseases, because it is like a everybody should be treated equally, despite any kind of disorders which is associated with social stigma. For example, the United States President Barack Obama he has newly invented the insurance coverage in such a way so that the mental illness condition is, the people who are suffering with a mental illness has been considered equally for the insurance coverage. These are some of the examples, and so in order to remove cultural negativity against the people who are suffering from these that's all from our end, and that's all. Thank you.
Okay. Thank you for the nice presentation. Now it's time for discussion. Please ask questions. I think Meenakshi is handling the slides, right?
Yes.
So you can run it from the beginning. and see if anybody can has any clarification or anything to add on. You can switch on your videos and audios now, no problem. You can share your experience also.
So do I need to go slower?
No, actually, I think if you don't have any questions, you can share some of your experience also. Some incidents in life where you have undergone this thing, experienced some social stigma or found somebody who is having social stigma. Sorry, these pictures which are there, any picture of any patient, right? Try to put a block on the eye to cover the identity, right? Yes.
Okay, sir.
I think Antri is not here. I'll send her the invitation. In the meanwhile, you start the discussion.
Okay, sir.
Just ask, just a little clarification. There are many more diseases might be there, right, which are associated with social stigmas. So,
You're asking any more disease, right, Puri?
yes, yes.
See, the thing is that out of this illness, right, I was thinking like in Malaysia, right, the social stigma actually happened to those like handicapped people. Maybe it's
Sorry?
about the deaf or for the what,
Hello?
hello? Can you hear me?
Think you're actually little disturbance. Maybe I cannot get the exact, points because your voice little bit breaking.
Okay. She's
Hello?
saying that, can you hear me?
Okay, yes.
Yeah, so she's saying that in Malaysia, stigma is generally associated with handicapped people.
Okay,
Yeah.
okay. Thank you, Ting, for the information.
Hello?
Hello?
Yeah, in Malaysia, what I've seen is that social stigma actually happen to those handicapped, like those who deaf and those who cannot speak or cannot voice out the milk. But nowadays they started to accept handicaps and actually arrange some like simple work for them to have a hands-on to work and they can be independent like that.
Okay, okay. And what about the people who are associated with certain kind of mental illness, especially children? Are they treated equally in Malaysia, especially? Hello.
Hello, Ting, can you hear us?
No.
Yes,
Excuse me, sir. Dr. Uncle, can you invite Anthony again, please?
yes. I sent her twice invitation. Anyway, I'm doing it once now. In the meanwhile, you just try to think of Purvi's question. She was asking whether the mentally ill patients are treated equally in Malaysia or not.
And especially children.
Yes.
Well, from what I heard from Dr. Peter who had come, I'm sorry, Dr. Philip who had come and taken class for us, when he was talking to us, him and then he was talking to us about mental illness, remember?
Yes.
And also Dr. Rajan. And Dr. Rajan was talking to us about the autistic children and the ADHD and all of that. He was telling us how even the parents have trouble accepting the fact that their child has a condition.
Yes.
Remember, so it is, I'm assuming it is still not accepted widely that, it's a problem, but it should not be made such a big deal and they should not be pushed aside. They should not be separated. I don't think that's something to expect.
Actually, the autistic child, if they have been recognized as early in their earliest age, like maybe in around 2 to 3 years, they if they undergo certain special trainings like speech therapy or you know um, some more trainings or education is if provided on them, then I think they can be in their later life they can treated equally as a normal child, right? If
Correct. True, but the only problem is when the parents have difficulty accepting that the child has a problem and needs help. They feel that it's too shameful for them to accept that their child is not normal, and because of that, they feel the treatment may be delayed. Apart from the fact that they might not have noticed that something is wrong, they may just feel that it's just that they start talking late, or it's okay, my child is just naughty. They probably start giving reasons for it, but what I think is they also have a problem of accepting that the child needs help because they don't want to accept the society.
And one thing in Malaysia is that when children's actually diagnosed with it's very difficult to diagnose there's mental illness in children because who are the ones that are going to diagnose them and check for them or what? Because they usually only go to the nursery or a school whereby the teachers they don't really have the hands-on on how to identify these particular children actually have the autisms or ADHD, something like that.
okay, but
Not
I
that
think
advanced in Malaysia yet, but so far I know that.
okay, but I understand that it's not the teachers who can diagnose the autistic child or the child with some mental illness, but at least they can notice certain differences between the normal child and the child who is having, I mean, who is at the borderline of autism or some kind of mental illness. So they can tell their parents that parents, obviously, parent might be aware of the child, but if I would suggest that if they would go as early as to the pediatricians, then or the specialist, then this issue can be resolved. I feel so.
Yeah, but the first thing first is that I think that if you if you want to have the early diagnosis with the mental illness among the children, right, then the teachers might need some basic information on how to identify that particular what are the symptoms of that. Then
Mm-hmm.
yeah,
Yes.
Now there is one thing you can think of. Not all the disease which we come across they are associated with social stigma, right? Only certain disease have got social stigma. Now why do you think so? Certain specific disease have social stigma, not all, right? What actually creates social stigma?
Maybe the fear of getting the disease with them, or I mean, say for example TB, tuberculosis as associated with social stigma means it's kind of people's conception, maybe their perception, thinking that if I, try to communicate closely and then I might be easily get affected. So maybe lack of proper education and
Yes, that is one aspect of it. Then why do you think people have social stigma against TB and not malaria?
I think, sir, because usually diseases that are easily spread to other people, that's when people become so, about it. Like
Yes,
malaria,
spread.
people will not get malaria. They cannot contract malaria from
Why
other
not?
people, but
Why not?
TB.
Why not? Because mosquitoes are everywhere.
Yeah, but not like TB, or you don't want to come close to the person, or HIV, things like that.
Yes,
Even for
actually,
leprosy,
what type of disease are these one? HIV, TB, what type of disease are they? What
communicable,
creates
communicable
contagious.
disease.
communicable and
Sorry.
communicable disease? Agreed. Anything else?
Means no medication so far available for HIV to
What is our commonest fear?
I mean
That
it
there's no
cannot fully
cure.
destroy the disease.
Letting
There
my
are
dying.
prevention medications and which can prolong the life, but eventually person who is suffering from HIV/AIDS, we know that he is going to die in the future.
Yes. So
Maybe
this is the
no
point.
cure for it.
The greatest fear which we face is one thing is suffering, chronic suffering, another thing is death. Right?
Yeah.
So any disease which is associated with chronic suffering or death, for which we don't have a cure, right, at this point of time, or might be even if the cure is there, the suffering duration is more, right? There we develop the social stigma. And then any disease which has got some kind of a physical deformity which is visible, correct, like in Hansen's disease. So this kind of things we usually get more of social stigma.
Right, sir.
Correct. And another thing is there anything which actually cause some kind of a what's it called, your inequity, or say uh, distinction between from the normal people with the others, like in mental illness or something, where actually the child cannot perform with the same potential as the other childs which are considered to be normal around them,
So
right?
basically, there is a deviance from other people.
Yes.
They're very, there's a boundary between them and other people because they are different. And that is where the fear of that, the particular disease comes up also.
And interestingly, discrimination is faced by the genius people also, isn't it?
Yeah, I think the social stigma actually happens to those who actually deviate from majority. So they are minority who are at the extreme side. And usually they will facing the stigma, social stigma problem.
Yes. Anything else you want to add, anybody?
One thing I would like to share, but it's out of
Yes.
it's not by the issue of problems, right? There's a one KFC, the Kentucky Fried Chickens in Sentosa, Sentosa that sites, right? They actually only hire the handicapped people to work for them. So those people who, yeah, like those deaf or maybe Down syndrome. So whenever you just approach that, but they will have one manager who are the normal people to help out. I think more of that kind of restaurant or something like that can work in Malaysia so that they won't be having the discriminations or being isolated in this society.
Right. Even in Mid Valley or something, if I'm not wrong, there is a place where, a massage place where only blind people are there,
Yeah,
Yeah,
yes,
I've
in
seen that.
restaurant, which I think is quite good for them. At least they can be independent, then they can work and then they can have some income, then they won't feel like isolated or and at least they feel they're approachable in this society.
Yes. Yes. With this, I would also like to add one point. Like, I would just like to share that in India also this kind of thing happens, especially the handicapped children. They they are they have been trained in some other skills like the craft work or the I think Dr. Ankur must be aware of those kind of activities, right? Which are run by the NGOs and they those children, though they are handicapped physically, but they are so well trained that they make lot of creative work such as the greeting cards and all that thing. So it's
That is
really
the care I think you are telling, right? They
yes. What is it? That cry, sir.
cry,
It is
sorry,
like
yes.
I don't remember
So,
the full name, but it's a cry association.
and nowadays actually we are not using the word handicapped. Instead of that, some other word
Physically
is,
challenged.
Physically
yeah,
challenged.
now something different also.
Yes.
What is it? Uh, it will be differently abled,
Okay.
right? Okay.
Sorry for using the wrong word.
Then anything else you want to add?
Sir, you were speaking about why it is a stigma earlier.
Yes.
And well, even small mental illnesses like depression or anxiety or something for which you need to visit a mental health doctor or a psychiatrist
Yes.
also turns out to be a stigma.
Anything which can cause discrimination, right, from the normal people or people around, right? That will cause stigma mostly.
Yeah, but what I mean, we initially were talking about how it arises when there is a fear of suffering, or prolonged suffering, or fear of death.
Yes.
In such cases, actually, there is no such fear.
This one, what's it called? Usually we don't, socially, there is not much of a social stigma for a depressed person, isn't it? I mean, if you see a depressed person, will you run away?
No, when you know that when you find out that they are depressed or they are taking medicines for depression or something like that,
Yeah.
people do actually have way of pushing back from them.
Usually, like normal unipolar major depression, they might not face that much of discrimination compared to if they have manic depressive psychosis,
Right.
where aggression, bipolar mood disorder sort of a thing. If
Yeah.
kind of a psychosis is there, we are more scared actually. The person might harm us, that
Uh,
kind of a thing.
okay. Okay.
Or that person might commit suicide or might try for a suicidal attempt, which might be difficult for us to, I mean, defend or stop. All right.
Right.
Sometimes we think like that, like our known people, they have a negative thought and they have a suicidal attitude, right? We try to avoid that kind of persons because we think that if that person commits a suicide or try to attempt a suicide, it will be a medical legal case and the police might be interrogating us, right? We might be in so much of other problems. That could be the thing. So I'll request Prof. John to ask something and then we conclude the session. Yes, sir. Sir, you have to unmute it. You have to unmute the voice. Sir, we can't hear you.
Okay, can you hear me now?
Yes, sir. Yes, sir. Yes.
Okay, just comments, no questions, because many of the issues were already discussed, but the presentation was very good uh, and quite comprehensive.
Thank you,
Uh,
sir.
all right, so I think today's session went off very well. Good.
Thank you, sir.
Thank you, sir. Thank you so much.
So can we have the first presentation again, the cross-cultural communication? Is it ready? If you want to take a break, what you can do is you just switch off the video cam and the this thing, the speaker. Then you can move around in your house, no problem. Right? You can take a break if you want. And those who are speaking, you can continue.
Anko, are you still there?
Sorry, sir?
Yes, sir, I'm here.
Okay, I think I will log out.
Okay.
All right.
Okay, thank you very much, sir.
Thank you, sir. Bye,
Thank you,
sir.
sir.
Bye.
Thank you very much. Next week, I'll show the video recording.
Okay.
Yes, sir. Thank you very much for being with us, sir. Yes, now who will be starting?
What are we going to do now?
The cross-cultural communication.
Cross-cultural communication.
The first presentation which we missed online.
We're going to do this right now.
Yes, who's going to handle the slides?
Oh, if I project it, the slide will be small. The size will be small.
Then Meenakshi, can you present the slides, or Faiza? I think first day Ting presented, right? The slides?
Yeah, she did.
Yes, then try that. Ting, are you there?
Yeah, I'm here.
Yes.
But others want to try out the method.
Okay.
Who is going to try?
Which one?
Ting. Ting.
Yes, a second. I was looking. I'm looking for the slide.
Oh, okay.
Entry. You may start now.
Yes, we can see the slide now. Yes.
Okay.
So, who's
Everyone is here?
starting? Yeah, more or less, I think everybody's logged in at least. Who's
Okay.
going to start? Andri is going to start.
Yes, I will start.
Okay, then start off. Maybe other people will chip in. Right? Okay, start then.
Okay, good evening, everyone. So today we will be presenting on the cross-culture communication in Malaysia. So let me start off with the introduction. Next. Okay, culture is a collective programming of a body, mind, and spirit that enables to distinguish members of one group with another. For example, nation, ethnicity, company, or category of people. Next. So some of the key elements of culture are symbols, for example, what we can hear or see, language, objects, jargon, dressings, and etc. And then rituals are like meetings, celebration, like funeral, wedding, or role models. Practices like how we demonstrate our values. Values are what we believe in. And underlying assumption is what is our perception, thinking, or evaluation of the world around us. It is the individual perception or a group of people's perception towards another culture or beliefs. Therefore, culture can be stated as the norm characteristics that are shared in a particular society, which eventually will influence the perception or thoughts or feelings of others. And as many cultures exist in this world, the meeting of one culture with another will lead to a process called acculturation. And acculturation can occur through the cross-culture communication, where people tend to adjust or adapt to the specific culture other than their own, mainly through communication. Next. Saying
I already put it as next. Hello?
cross-culture communication is basically the messages between people of different cultural background. So there are two types of we can define culture into two different contexts. One is the high context culture, where people tend to rely heavily on a non-verbal communication like eye contact or gestures, whereas the low context cultures are those who are highly dependent on words. Okay, when we narrow it down to Malaysia, Malaysia has a lot of cross-culture communication taking place each and every day of our lives. And Malaysians are known as the mosaics of cultures because we have Malays, Chinese, Indians, and also other indigenous groups like Bajau, Murut, especially at the East Malaysia. So in Malaysia, the three main races are Malay, where they comprise of 50% of the population, and their main religion is Islam, and they practices Malay traditions. And the second highest population is the Chinese, 25%, and the main religion is Buddhism, and they practice Chinese tradition, and main dialects of communications are Hokkien, Mandarin, and also Cantonese. And the third largest populations are the Indians, where they mainly practice South Indian cultures, speaks in Tamil, and main religion is Indo. So now, when there are so many cultures exist in a particular country, what are the problems that might arise, and what are the possible solutions to this problem will be discussed later in this presentation. Now I will hand over to Stigma.
Good evening. So I'll be continuing with the terms and definitions. So first thing first that we have to know is about the culture. So culture actually is the cumulative deposit of knowledge, experience, belief, values, norms, and attitudes in a large group of people. It is usually referred to what people created by majority. It is shared and it's learned and it is dynamic and usually will be passed on from one generation to another. So there are two categories of cultures. One is the material culture, the other one is non-material culture. Material culture is a physical evidence of a culture, the object that we can see. For example, it's like a clothing. Let's say like in Chinese culture, they wearing their traditional wear is cheongsam. For the India is the sari. For the non-material culture is the thoughts or ideas, something that we cannot see. Some ideas, some thoughts that the society follow according to their belief. So the component of the cultures, they are the basic components are technology, symbol, language, belief. Technology actually is the objects and rules for using them. A symbol is something that represents something else. And language is a system of symbol that allow members of society to communicate to one another. And belief is that it's something that constructed for how they think about something. And values, it's about the idea. It's a general or shared belief about what is good and right or important. And the norm is actions that has been carried out according to the values and belief. And true example of the norms are the mores. Mores are something that have the great moral significance. For example, like the rules, they have rules and laws on the violations that will endanger the stability of the society. Whereas the fourth way is a norm that has less moral significance. For example, like if we are asked, we are supposed to respect the adults. So if we're not if we are not respecting the adult, we won't be charged by the laws or rules. No laws or actions will be taken for that. So next will be the cross-cultural or intercultural, is actually the interactions between the individuals from different cultural background, as well as the cross-cultural communications is the study of the individual from different cultural background on how they communicate to each other. And one of the example are is the cultural anthropology, is a study of contemporary historical cultures among humans over the world. So cultural shock is the state of the tensions when a person being allocated to the unfamiliar cultural environment, and they find it difficult to adapt to the new cultural environment. But once they are able to adapt to it, that is when the acculturations take part. It's a process of adapting to a specific culture. So ethnocentrism is the tendencies of one group, they judge another group based on their own standard. And the cultural relativism is the belief that culture actually should judge others group according to the standard rather than according to what themselves think of. So subculture is a group of people who share the certain parts of the belief or norms, but they are actually set them apart. They share some same part of the mainstream, but other than that might be different from the dominant culture. So counterculture is a subculture that actually contradict, and they actually don't want to be in the mainstream of cultures, and they seek for the alternative lifestyle for themselves. So that's it for my sessions. Next will be Faiza that presenting the issues on the cross-cultural communication.
Thank you, Anne. Thank you, Tan. What are the issues of cross-cultural communication in Malaysia? The first one is the attitude of Malaysians. Usually, Malaysians rely on non-verbal communication. Example, facial expression, tone of voice, body language, and so on. So Malays may hint at a point rather than making a direct statement. So this will cause difficulty in understanding the direct and non-confrontational behavior of Malaysians in terms of expressing their personal opinion. In Malaysia, confrontation is seen as losing your face, and people take it negatively, unlike in other places. So silence is an important element of Malaysian communication. So expatriates find it difficult to have direct confrontation with the locals when a problem arises, and it's very uncomfortable in expressing their views in situations. The second one is Malaysians' misconception toward Westerners. Malaysians do not understand the Western propensity to respond to a question hastily and can consider such behavior thoughtless or rude. Due to the lack of exposure among some Malaysians toward other parts of the world, it leads to misconception when cultural clashes, because usually generalization were easily made toward foreigners. The third one is custom and religion. It's very important understanding the dress code of Malaysians. If Malaysians do not dress themselves according to social norms, negative remarks were bound to be heard, although it may not be directly voiced. The fourth one is the religious issues. Religious plays an important role in Malaysian society. As Anthony mentioned, most of 50% of Malaysians are Malay and they are Muslims, and so their work culture is deeply rooted in their religion. So foreigners found themselves being cautious over action made towards the local Malays, either at workplace or in other places. The fifth one, addressing social status. It's very common in Malaysia to address somebody, an elderly person or somebody that has a status with Tansri, Dato or Professor, which is different from other foreign culture, which informality and direct way of interaction are the norms. This relates to the value of respect for elders and hierarchical relationships. So usually a brother, an elder brother or an elder sister will be called, something will be called before the name. Social formalities may also act as a gap in communication and in some instances making the social interaction uncomfortable. The Malaysians' working habit can be very difficult in complying with the work pace as the working trend differs compared to high industrialized nations. Mainly, people at the high management level acquire strong control over issues at the workplace, and this will affect the flow of work among locals and expatriates. So most of the decisions are made by the people at the top, the top management, and duration of task completion may take longer than expected. The local working habits seem to collide with the expatriate working habits as their working style differs. Healthcare. Effective communication is essential to ensure patient safety, accurate diagnosis, and health promotion. Most of these ethnic minorities in Malaysia have poor or no English language skill, so it's very, very hard for them to actually explain or their medical history or to arrange for appointment by telephone or explain the side effect, diagnosing and communicating problem to them. For example, this is a typical example of a cross-cultural communication. In UK, this means okay, but Japan it means money. In Russia it means zero, and in Brazil it's an insult. So this shows that there is a lot of cross-cultural communication between different countries. Thank you very much. I will give it to Meenakshi to continue with the solution.
So it is very important for a multicultural community like Malaysia to have proper cross-cultural communication. Common precautions to be taken in cross-cultural communication, either casual or business, should be first to slow down, meaning people should talk slowly and clearly so that people can understand, others can understand what is being spoken. Need to choose appropriate words. Simple language must be used so that everybody around can understand. Not everyone understands English or the common language that is being used, and simple language should be used for the benefit of the others. Separate questions. Very often we have the habit of putting 2 or 3 questions together in one sentence. When in a business setting, such a phrase is used, the person might understand just the first question or might grasp just the first question and might miss out the second or the third question. As I said before, we should also use easy and simple words. Write it down. It is important to write down and make notes, especially when numbers are being used. When there are large numbers, it is hard to remember, and to prevent miscommunication, it is important to write down and make notes. Be supportive. It is very important not to laugh at a person or look down upon them just because they are not comfortable in talking in a particular language. They might not be used to it, and they should be supported in the effort that they are making. Check the meaning. While speaking, it is very important to check the meaning of what you are speaking. You can very easily say something, you might mean something else, and it might convey as something else to the person you are talking to. So it is very important to speak clearly and check the meaning of what you're talking. Avoid using slang. Every local city or country has their own dialects and colloquial language, which is called the slang. So it is important to be careful to not use slang, especially among foreigners, because it is not possible for foreigners to understand all possible slang that is there in the language. Watch the humor. Some communities are very serious about their business and they might not appreciate humor being used, while some others are okay with the use of humor every now and then. But the way it is conveyed is very important. Avoid negative questions. It is important to avoid questions which could convey a negative meaning. A sentence could be said in two different ways. It could either, in English, generally answering yes indicates an affirmative answer, while no indicates negative. In some other cultures, yes or no may also indicate whether the questioner is right or wrong. For example, saying, "Are you not finished yet?" may be yes, which could mean yes, I am not yet finished. Take turns. This is very important in a business setting, especially when there is a meeting or something going on. It is important for a person to speak, and the people listening should listen effectively and not interrupt the person who is speaking. Effective listening is very, very important in such situations. Maintain etiquette. Always a good idea to undertake some cross-cultural awareness training, or at least do some research on the target culture so as to be able to maintain the etiquette practice in that particular culture. Communications, writing and sending emails. This happens mostly in the business setting. When communicating for professional purposes, there is a certain protocol to be followed when writing and sending out official emails. Always use a subject line. Use emoticons and acronyms sparingly for business communication. Write clearly and briefly. And it is always important to sleep on angry mails so that you don't respond the same way as the person has sent you a mail. I'll now pass it on to Pooja. Thank you.
Thank you, Meenakshi. Good evening, everyone. Thus, the culture is the lens through which we can see the world, we can interpret and express ourselves through a system of our own practice, knowledge, attitude, beliefs, and our own values and traditions associated with it. Cross-cultural communication is important because it involves movement of people, goods, as well as information that can create business and job opportunities, sharing of ideas, as well as it improves contribution of employees in a diverse workforce. Cross-cultural communication, however, it is very challenging because it requires effective communication with people of different cultural backgrounds. As mentioned earlier by Anjali, in Malaysia, mainly Malay, Chinese, Indian, and other indigenous groups exist. So there are various cultural backgrounds exist in Malaysia. So Malaysia is really known for diverse cultures with different ethnicities. However, some issues like attitudes towards foreigners, more incorporation of more non-verbal languages, and some religious issues, as well as the Malaysians' health attitudes and behavior towards the healthcare practice are important issues. Thus, to improve cross-cultural communication in Malaysia, one must first overcome ethnocentrism. They should give equal importance to every cultures, every traditions, and they must try to learn and respect other culture and their languages as well. That will enhance intercultural or cross-culture communication skill and will help to reduce the burden of cross-culture cultural shock. Cross-culture. Thus, I would like to conclude that cross-culture communication is about dealing with people of different cultures in a way that will minimize the misinterpretation and it will maximize our potential to build strong cultural relationships. Sometimes goodwill and a friendly smile can overcome many barriers, and patient trust and sensitivity are the part of some international language of humanity which goes beyond the words. Thank you. That's all from our end. Thank you, sir.
Dr. Anko?
Hello.
Let's discuss about questions. Do you have any questions?
I think this was earlier discussed, right? The seminar already discussed.
Dr. Anko?
Do you guys have any further questions?
Is Dr. Anko there?
I'm not sure.
Not
Let me
sure
go
if
on with the questions. Do you guys have any questions?
There online, but I can't hear him at all.
no question from my end.
You want me to go through the slides again and see whether you have any questions?
But
Yes,
since this was already discussed, right? This is just the presentation we are giving. The discussion part is already did it. Do we need to discuss question as well?
Can we see each other's face?
Yes, if you want, but I think it's recording better not.
Okay.
You know the conversation is recording also.
Dr. Ankur is here.
Yes.
I can't hear him.
We can't hear
Yeah.
you.
Is he on mute?
No, he's not showing me.
Not
No,
muted.
we cannot hear you, Dr. Uncle.
Let me mute him and see. Oh, he said let us discuss.
We already discussed
Hmm,
in class. Are we going to discuss again the same thing?
then go through slides one by one. Cannot hear you, Dr. Uncle.
Stop me whenever you have any questions on the slide. Regarding the slide.
Sure.
No.
Okay, let's discuss this. One of the problems discussed by Faiza is we have Malaysians do have a misconception about the Westerners, right? Okay. Do you think that This miscommunication could occur also due to the foreigners who have a different culture and background. So when they come to Malaysia, the problem is not only from the Malaysian, it could be from the foreigners as well, right? So what do you think?
Yes, Anthony, I think it's equally the same. It could be from the foreigners, and I think it's a normal thing in every country that there will be miscommunication between a foreigner and a local. So you're asking what could be done, right?
Yes.
I feel that, hello, can you hear me?
Yes,
Yes.
we can hear.
I feel that, yes, it is both ways, but also that, you know, since they are foreigners and they are coming to your country, you
Yes.
should be a little open towards their behavior so that they can actually settle in and also react well to your culture. You know what I mean? Any
Yes.
foreigner coming into any country needs to first feel welcome. That's when the problem of this whole ethnocentricity comes, because you see them through your values and your morals, and we never have this habit of taking into account that they have been born and bred in a different kind of environment. So I think that is also a very important point to be considered.
I think, Meenakshi, you mean foreigners means the Westerners, especially, right?
Yeah, yeah,
Because their culture, their the upbringing is totally different from the Asian countries
exactly,
people,
exactly.
right? So
It's
that's
very,
how they
yeah, so it's very
see
important to have
the,
this in mind.
yes, they see the Asian people in a different manner, and we as an Asian or the Malaysian look towards the foreigners. They have a little different attitudes towards foreigners. So maybe the lifestyle is totally different from our
Yeah,
cultures. That's why I think.
exactly, exactly. It's like if we as Asians went to the US and we try to blend into their culture. Theirs is a more
Yes.
easygoing culture, so it's probably not as hard. But for some people, it is quite hard. And if they become, very judgmental about the way you behave or anything of that sort, then that becomes a problem. Then we feel not welcome in that country.
Okay, guys.
Okay,
I
thank you
think
guys. I
we
think we can go off.
can end
Thank
our
you.
session now.
Yes.
Thank you. Good night. See you tomorrow.
Good night, all. Good night, sir.
I don't think you can hear us.
Oh, really?
Bye.